Hi, welcome to another episode of KidzDocTalk with Dr. Jennie. Today's guest is Dr. Dubrovskiy, and we're going to be talking about screen time.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the Director of Telemedicine at Pediatric Associates.
Dr. Dubrovskiy attended medical school at Nova Southeastern University and completed her pediatric residency at Good Samaritan Medical Center, where she also served as chief resident. Dr. Dubrovskiy is currently the assistant lead in our plantation office, and her interests are preventative care and child development. In her free time, Dr. Dubrovskiy enjoys spending time with her husband and her 3 energetic kids, traveling, and being a full-time soccer mom. Hi, Dr. Dubrovskiy. Welcome to KidzDocTalk.
Thank you very much for having me. Very excited to be here.
Good. We're excited to have you. We're going to talk about one of my favorite topics and one of my least favorite topics because I feel like it comes up so much and I really struggle with it. So I'm excited to do a little bit of a deep dive today on screen time, specifically how we're seeing screen time sort of change and how our expectations change during the pandemic. So first, give us a little bit of an idea. What is screen time? Because I think sometimes parents think it's just like looking at a phone and playing video games. But when we say screen time, what do we actually mean?
Excellent question. So screen time is a term to describe the amount of time and activities that are done in front of an electronic device. However, it's not limited to the traditional just TV in the background. Of course, we have our tablets and our smartphones and our video games. And what's happening, especially in the current pandemic situation, is that the screens are more accessible and portable than ever. And I wanted to talk about this topic because I have seen a dramatic amount of increase in screen time for my patients and even my own house as well.
Definitely. Yes. Agreed. Likewise. So a little bit of a baseline to start out with. What is the average number of hours that kids have any sort of screen time? Like what do we think is happening?
A survey was released by Common Sense Media, which is a nonprofit that tracks young people's technology habits, and that nearly half of all children under the age of 8 have their own tablet device, and they spend an average of 2 to 2.5 hours of time on a digital screen. And the number goes up as children get older. So children ages 8 through 10 spend an average of 6 hours a day in front of a screen, and actually the highest amount of time in front of a screen is for our kids ages 11 to 14, upwards of to 9 hours a day. Now, the time goes down a little bit for our youth, ages 15 to 18, but they still spend a considerable amount of time in front of the screen, up to about 7.5 hours.
Wow. Those numbers seem like astronomical to me, I think, considering how long kids are in school. Because what that tells me is basically they're in school and then they come home and everyone's just on screens. So we obviously want to make some recommendations against that. What does the AAP say? Because I've seen some recommendations kind of pre-COVID, and then I think post-COVID they had to adjust their recommendations based on what you described as realistically happening. So what does the AAP say about all of this? What guidance do we have?
In the past, the original American Academy of Pediatrics guidelines for screen time are a lot more rigid. So before, absolutely no screen time was recommended under the age of 2. And then after the age of 2, no more than 2 hours a day in front of the screen were recommended. But you are absolutely right that the overall media use and accessibility and in-person and virtual learning has really dramatically increased the amount of time in front of the screen. And so the AAP stepped up with its recommendations. There's now an emphasis on the quality of kids' media and how it fits in a family-specific lifestyle. So there's not a one-size-fits-all approach, but they do have some general recommendations based on the age. So for infants under 18 months, screens should be discouraged. However, it is okay for video chat. So FaceTime and Skype and WhatsApp, as long as there is an adult close by to supervise, to co-view and talk, they found that young babies can actually benefit from video chatting. A 6-month-old, though, even though they're captive by a device screen, they really don't learn anything of it, but emerging evidence has come out saying that as young as 18 months, children can actually start learning new words from video chatting with an adult. So between 18 to 24 months, digital media can be introduced with two stipulations. So the first is what I said before, that we should have an adult that is co-viewing and teaching the kid. And the second is that it should be high quality programming, TV and application. PBS, Sesame Street, Daniel Tiger's Neighborhood, the type of shows that really focus on how kids are socializing together, good model social skills. We want to avoid any TV shows that are too fast paced or anything that has a lot of distracting content. So from 2 and up, the recommendation has actually shifted a little bit in that they do want to limit entertainment media to no more than 1 hour per day. The research is that young children who watch 2 hours a day as when they're young, they tend to maintain or increase the screen time through adolescence. And more than 90 minutes of daily screen time a day has been associated with obesity.
Wow. So, I mean, I feel like that's super reassuring and definitely helps us deal with like parental guilt of how much screen time realistically kids were getting. It also seems really, I think, important for them to have made the nuance of like high quality, right? PBS, that kind of stuff, because I definitely think there's a difference between watching that and like playing Fortnite, right? Or like watching YouTube and watching like, I don't know, like toys being unpacked. I definitely think that there's a difference between those two types of screen time. So that seems, I think, more in line with realistically what's happening. So if we're looking at kind of like the goals of where we should be with screen time, what's the purpose of trying to limit it? In other words, what are we trying to avoid? What are things that we're seeing as a consequence, specifically in terms of kids' ability to learn and their development? Like, what are things that we're seeing when it comes to kids who have too much screen time or too much of the negative type of screen time that we want to avoid?
There are several population-based studies out there that have shown associations between excessive television viewing in early childhood with cognitive, language, social, and emotional delays. So, as you know, children learn best from face-to-face interaction. For young kids, especially under the age of 3, development is happening rapidly. And how do they learn? They learn from exploration of their environment. They learn by imitation of adults and other children around them. When with screens, the child's ability to observe and experience the everyday life is inhibited. It's almost like a tunnel vision. Mm-hmm. So with playtime is being decreased, then creativity is being stifled. And there have been so many studies that shown that the skills to succeed in school, like impulse control, staying on task, emotional regulation, creativity, like I had said, it's best taught through unstructured social play. I did want to touch on language a little bit because that's very important for development. So kids, if they're learning from a screen, they can definitely repeat what they see on the screen, but the screen doesn't give the necessary feedback that's necessary for development. So the support and praise that a child can get if they answer a question correctly, that is lacking. And more importantly, if they don't repeat the words correctly or answer it negatively, then they don't get that correction and they don't get that encouragement that way. So studies have shown that kids who watch a lot of television in the early elementary years, unfortunately, perform less on reading tests, show deficits in attention. And that's just only for the language development. Social development, too, can also be affected. Kids who are looking at the screen might find it difficult to be engaged with non-electronic activities. So some kids, you see, they're so attached to their screens that they aren't able to behave in a socially appropriate manner when screens are not present. They don't have that reciprocal dialogue. They don't have the back and forth conversation, reacting to facial expressions, reacting to the other person. And so it's been linked to behavioral issues as well.
I can definitely see that being true even in my own patient population. When you enter even an exam room virtually or otherwise, and somebody has a screen in front of them and then like you try to take the screen away, it's absolute chaos. And so you can definitely tell the difference between kids who, use it as almost like a social crutch and who really have a hard time navigating like any situation without it being present. So definitely makes sense that it would be an impediment. One other thing that I think I'm seeing more now, and I think it's for a lot of reasons because of, pandemic induced anxiety and things like that, but I'm seeing kids really, really struggle with sleep. How much do we know of, whether screen time contributes to that struggle and whether it interferes with quality sleep?
Screens do impact the child's sleep quality. So the display screen of digital devices, they emit this blue light.
Mm-hmm.
Blue light is the shortest wavelength for the highest energy. But unfortunately, the blue light from the screen can affect melatonin, which is the sleep hormone. It basically regulates our circadian rhythm and tells our body when to sleep and to when they wake up. And so if you have a delay of the production in melatonin, then that results in delayed sleep, poor sleep, insomnia. And then poor sleep over time can lead to chronic daytime sleepiness, which then leads to obesity and other medical issues that I'll get into.
And more behavioral problems at that point, right? If they're having daytime sleepiness, right, then they're not behaving their best, they're not learning their best. So it's like a little bit of a vicious cycle. And then they have a hard time falling asleep. So it's a tough cycle to break.
The blue light I was telling you from before, it actually can affect different stages of sleep. So slow wave and REM sleep are the two cycles of sleep that are crucial for memory and mood. And so if that is suppressed, then that could also affect the behavioral, like we were saying before. I would say tablets and smartphones are probably the worst offenders in that they're so close to the face. So the blue light is a lot closer to the face. And so babies who've been exposed to screens, they actually have shorter nighttime sleeps. And kids in general are more vulnerable to the negative effects of blue lights from the screen because their eyes are more sensitive to light. Blue light suppresses melatonin production nearly twice as much as adults.
Wow. So I've seen some recommendations of like when you should stop any kind of screen time prior to a designated bedtime. Is there any kind of like hour cutoff that we should be using as a guide?
Absolutely. The recommendation is an hour before bedtime, then all of the digital screens should be turned off.
I think that's really important. I'm sure that's like a struggle because a lot of times that's like the screen time that the child earned right at the end of the day. So I think that's probably very challenging to do, but important to enforce because it sounds like there's a huge interference and has the potential to cause really significant amount of issues. So you sort of brushed on obesity, but I want to talk about that a little bit more. How are we seeing screen time affect obesity? I know just in my patient population, I'm seeing obesity just skyrocket now, again, because of so many factors due to the pandemic. How much of that is influenced by screen time?
Greater amounts of screen media use definitely has been correlated with higher amounts of obesity or fat, high body fat in children. And there are three reasons as to why this is. One is increased eating while we're watching our screens, leading to increased caloric intake. So snacks, which are the easiest for kids to get usually while watching TV, are very high calorie, low nutritious foods. And evidence shows that when kids are watching screens, they're distracted in that they have diminished attention to the satiety cue. This can prolong the eating episode. They'll just keep on eating until the show ends, or we'll just keep on eating until the bowl is finished. And so kids don't realize that they're already full. The second reason how screen time is tied to obesity is actually through advertising. They did a study in 2016 that kids saw an average of 11 to 12 ads per day that promoted high calorie, low nutritious foods like fast food and sugary drinks and junk food. And the issue is kids under 6, they really can't distinguish between what normal programming and what advertising is. And so after seeing constant repeated exposure to all these ads, then they're more likely to choose these products or ask mom and dad, hey, buy me this. And so it kind of becomes more of a vicious cycle. And then also to lead in that screen media causes obesity because, again, tied to poor sleep. If you have poor sleeping habits, then kids tend to eat outside of their normal meal times. They tend to eat later. Sleep causes a hormone imbalance. There are two hormones, leptin and ghrelin, that help regulate appetite. And so if you're not getting enough sleep, then these hormones are imbalanced, and that causes increased feelings of hunger. And then finally, there is less growth hormone that's being produced, and elevated cortisol levels, which is the stress hormone, and reduced sleep. And all of this can be linked to obesity. So it's very much tied to obesity.
We talk about all these things like, right, kids being, maybe tricked into eating a little bit more, kids struggling with giving up, right, the screen and struggling with social interactions. It almost sounds like there's an addictive quality to it. And I've seen studies that compare like kids and their relationship with the screen almost to like a substance abuse and sort of, a similar mechanism going on there. Is it truly like that? Is there really, it's sort of an addictive factor to all of this? Because I feel like then if anything makes all of this so much trickier and so much more difficult to navigate.
The main issue is that mobile devices are portable and they're everywhere. And unfortunately, a lot of the digital applications like YouTube or Netflix, they have this auto advanced setting at the end of each little segment. So without even realizing it, the next episode starts or the next clip starts, and one can lead to another and another. And adults, we understand more or less, and we could stop or put our phone down or turn off the TV. But kids, they don't realize that there's any issue with it, and they'll just keep on watching it unless they're told to do so. And so what happens is if this digital media is introduced at a young age, it becomes normal for them, and this becomes almost like a behavior for them, and it's so hard to stop that behavior.
Makes sense. I've definitely seen that happen with patients, with my own kids, and even with myself, right? It gives you the option to like another episode. And unless you have that, like, no more, you kind of fall down this dark hole of watching way too much, more than intended. So, okay. Is there any good news in this? Because we kind of talked, right? Sesame Street and Daniel Tiger, and those have some really sometimes beautiful and positive messages in it. So is there any benefit that we're seeing from different types of screen time?
It's important to remember that devices are not evil. They don't need to be avoided. It just needs to be balanced with all the other things that kids need. So exercise and sleep. But aside from internet, screen time is actually very good for learning and socialization. So as I'm sure you've seen, especially during the pandemic, the screens have enabled us to safely connect virtually with many people at the same time. So apps like Zoom and Microsoft Teams, we can reach a large amount of people from virtually anywhere across the globe. For learning, for school-related homework and research, the internet has tremendous resources that you can instantly access. And screens, they do give this unique ability, like different activities that kids can find engaging, such as games and music. But I think one of the benefits of screens is that it's a great place to connect with other like-minded individuals. So it's a lot easier to find other children who have similar interests, whether it's coding or with video games or doing online toy reviews, like you were saying. If moderated appropriately by adults, our kids can find a community. And that's really important because it enables them to explore interests and hobbies that really are not available in real life or not as accessible as it once was.
That makes sense. And I feel like a population that is really benefited the most from that, I think, is like the older kids and like younger teenagers, right? Because they're not able to maybe socialize as much now that there's a pandemic, right? Maybe they don't have in-person school. And so they were able to kind of build on their socialization a little bit. Any other specific effects that we should be aware of when it comes to teens and screen time? Because obviously they're exposed to it much more.
Exactly. So as stated before, teenagers, they spend up to about 9 hours a day using screen media. So compared to earlier in 2015, teens are spending a significant amount of time watching more online videos. So thinking TikTok, think YouTube every day. Fewer teens are watching live TV. They prefer to watch shows on their own schedule, on their own favorite devices, wherever on their own, right? The smartphones are everywhere. So for now, about 2 in 10 8-year-olds now have a smartphone. And now that goes up to, by age 12, about 7 in 10 children have a smartphone. And by 16, virtually all teenagers have their own smartphone. boys are different than girls. Boys tend to play more video, computer, and mobile games, and girls are more likely to listen to music, use social media, and read digital devices. So teens especially use social media a lot more. It's been reported that they can use social media for about an hour every day on average, and almost 2/3 of teens say that they use it every day. Now, like I said before, not all screen time is bad. And so for teenagers, it's great for researching a school project, creating music or art, interacting with friends via social media. But unfortunately, it does include less productive activities like watching inappropriate shows or visiting unsafe websites.
That makes sense. So are there anything that parents can do or families can do to try to limit screen time? Because I think that's kind of like the message, right? Like there's too much of it. We should try to cut down. We should try to kind of at least guide to a little bit more of a positive direction. So what can we do? What's available out there? I've seen AAP put out some like contracts, sort of media plans. Tell us a little bit about what we can do and what's available.
So first of all, what I like to tell my parents is to be realistic when you first start out, right? So right now, especially during the pandemic, everyone's at home. Kids are spending a lot of leisure time on the screens, but there are things that we can do or that are provided for us so that way we can handle it. So the American Academy of Pediatrics has an online tool called the Family Media Use Plan. You can find it on their website. And what we realized that each family dynamic is different. And so this website is perfect because it's able to create a customizable approach for your family, depending on how many kids that you have, what are their ages, because screen time is different for our younger infants and then also for our teenagers. There are some recommendations, though, in terms of what families can do to tackle the increased screen time. The first is to have screen-free zones. So bedroom, kitchen, and in the car, try to avoid the screen. So for the bedroom, charge your devices overnight outside of the bedroom. We want to limit the kids' temptation to go check their phone to see what's going on or any incoming messages or calls. We want to kind of keep that away so that way it doesn't wake up the kids from their sleep, as well as decreasing amount of time away from that blue light. The kitchen, like I had said, we want to keep that screen-free zone for meal times and social gatherings. And then in the car, there really is not a need for the screens, except maybe for long trips, to combat the time. So that's the screen-free zone. But the next thing that we also recommend is screen-free times. So like we were talking about earlier, no screens an hour before bedtime, but also no screens during dinner time. And then based on your family, pick another time. It could be Wednesday nights in which everybody, parents, kids all put down their screens and just arrange time to be together.
I think that's really fantastic. I feel like I could benefit from some of that, like not having devices in my room and like having messages come in at 2 a.m. that I need to answer because of course I don't. So that's really fantastic. Any other like resources or any other things that we can kind of guide families to be able to choose the type of screen time or the quality of the screen time that their family is exposed to?
One website I really enjoyed is called Common Sense Media. It is an online reviews website that keeps families in mind. So it looks at movies, TV shows, apps, video games, and books. Healthychildren.org through the American Academy of Pediatrics is a very good resource. And of course, there's your local pediatrician.
Excellent. I love all of those resources. I love Common Sense Media. I always look stuff up there to kind of check myself before we, sit down and watch a movie as a family or even books. So I think that's a fantastic resource. I actually also recently watched a documentary. It's called Childhood 2.0. I don't know if you've heard of it. It's a free documentary. You can just Google it, and it's produced by a pediatrician, and it's all about screen time and kind of social media exposure that kids have in this day and age. And it was so eye-opening and really was like a reality check of the type of struggles that kids have. So I really also highly recommend that. It's available. It's a free documentary that you can just look up. Anything else that you're seeing in your own patients or any other guidance that you're giving families during this obviously super challenging topic and in this challenging time?
Well, in my own practice, I find that there are some children that are thriving virtually. There are some children who like the ability to work at their own pace and prefer to be more on their own. But then a majority of kids, especially those with behavioral issues, or if they need speech or occupational therapy services at school, or if they have ADHD, they perform a lot better with face-to-face interaction. And like you were saying before, in my own population, like many of my colleagues, I've noticed a significant amount of weight gain in kids. And unfortunately, I'm seeing some more bigger issues due to social isolation. Yeah, I do have one final tip for parents, though, is to be a digital media mentor, meaning kids they look to you to what you're doing. Parents are the most important people in kids' lives, and so they will model the behavior that they're seeing. So limit your own phone use, and really importantly, co-watch with your kids. Ask them questions about what they're watching. Reteach them any lessons that is found on the screen and show them that you are engaged in what they're doing. And by doing all these things, we can teach our kids how to use screens in a meaningful, moderate, and healthy way.
That's wonderful. That's actually really, really helpful. Thank you so much. Really fantastic, concrete advice on a topic that I think we're all struggling to navigate. So thank you so much. Very, very helpful, and hope to have you again back very soon.
Yes, thank you for having me.
Make sure you like us on Facebook and follow us on Instagram and Twitter. Thank you for joining us on KidzDocTalk.